Good morning, Dr. Palermo with this week's Motivational Monday. At Thrive, we are always talking about optimal health. Now, we spend a lot of time helping people with medical issues and trying to reverse them or prevent disease, but that doesn't mean we're not looking for optimal health. And part of our approach to this optimal health is getting the right lab tests. Most of the time, patients will tell us they go to their conventional practices and get a very basic number of labs done, and they're told they are totally fine, and then later on are found to have a medical issue that may have been picked up had their testing been a little more in depth. A perfect example is cholesterol. Most people just get the basic lipid panel, which is your total cholesterol, your HDL, which is your good cholesterol, LDL, which is deemed bad cholesterol, and triglycerides. This is the basic panel most people get. But we now know there's more to cholesterol. And a perfect example is a more expanded version called an NMR, or something we do through Boston Heart Lab. But even an NMR is much more in depth than that basic lipid profile, because it turns out all LDL cholesterol is not bad. So other things to look into are the actual particle numbers, how many particles you really have, and if those particles are the large fluffy ones, which we now know are important for hormone production, brain health, and also cell membrane support. If they're the small type, then those are the ones we know are inflammatory and increase our risk for heart disease and stroke. So it's really important to stratify these numbers even more. There are also different forms of cholesterol that can be highly inflammatory, and so we want to look and make sure that is not what might be putting you at risk, and a basic lipid panel is not going to do this. So this month we are going to be talking about on our podcast some of the tests that you're not getting that you should be getting, and this would be an example of one, this NMR. So definitely watch out for our podcast, and we'll have a lot more information coming. Take care and have a great week.